So, hello everyone. This is Dr. Sumina, once again bringing you greetings. So, today we'll be discussing a very basic topic, how to conceive naturally and how to increase your chances of conception naturally. I'm going to be sharing few tips with you today. The first step is understanding your body and the science behind the pregnancy. Even if a man and a woman are perfectly healthy and they are having an unprotected intercourse in the cycle, the chances of pregnancy are just about 10 to 15% only. This is perfectly normal. In fact, a couple might take about 6 to 12 months of unprotected intercourse to become pregnant, and that is normal. Also, you must be aware about the fertile period in your cycle. The ovulation is a process whereby a mature egg is released from one of your ovaries approximately 14 days before your next period. Remember, the egg has a life for 24 to 48 hours, and even sperm survives for 48 hours inside the woman's body. So, 2 or 3 days before and 2 or 3 days after the ovulation is the fertile window, and it is during this time that you need to have intercourse, maybe every alternate day or even every day, to increase the chances of fertility. Also, the sexual positions do not really matter, and amount of sperm leakage is usually normal, so do not panic. Also, there are number of doubts about vaginal lubricants when you are trying for pregnancy. Just remember that lubricants which have glycerol and paraben should not be used. Also, remember, no sexual position or any particular day of the cycle guarantees you the sex of the baby. Always remember, you have a chance of 50% of producing either a boy or a girl every cycle. Next important step is optimizing your body for conception. It is very important to be in optimum stage for conception. So the first is diet. According to most of the scientific studies, women who take lots of fresh fruits, vegetables, cereal, grains, pulses find it much easier to conceive than women who take more of processed and packaged food. Remember, fresh foods have more of antioxidants which help your fertility. It's important to maintain optimum body weight. Being overweight increases your chances of polycystic ovaries, insulin resistance, thyroid, and many more hormonal disorders, which once again can cause your menses irregular and disturb your chances of getting pregnant. It is important to curb your caffeine intake when you are trying to become pregnant. 200 milligrams of caffeine per day is allowed, which means not more than 2 small cups of coffee every day. Remember that caffeine could also come from green tea, aerated drinks as well, and smoking is not allowed. This one is absolutely non-negotiable. It is very important to be physically active and to exercise. In fact, it's a myth that people think that when they are trying for pregnancy, they should not exercise. Probably they think that this is going to interfere with the implantation of the embryo or can increase the chances of miscarriage. This is absolutely wrong. Exercise actually is going to help you with your insulin resistance, keep your weight under check, keeps all the hormones within normal limits, and may actually increase your chances of getting pregnant. But remember, it is the moderate and consistent exercise that is important. The third most important thing is preconceptional counseling. Now, this is absolutely important. The gynecologist is going to take your detailed medical history. It is very important for chronic conditions like hypertension, diabetes, thyroid diseases to be brought under control before going for conception. The doctor will ask you for certain lab tests like complete blood picture, blood sugars, thyroid, prolactin level, a rubella test, and certain tests for infection. We also like to get an ultrasound done. It is also a good idea to get a pap smear done. The doctor will start you on prenatal supplements like folic acid. Folic acid deficiency is known to cause birth defects like neural tube defects in the baby. So it's very important to start using folic acid. I always like to give my patients vitamin D supplementation. The recommended dose of vitamin D is about 400 to 800 international units per day. There are a lot of other vitamins like vitamin A, B, C, D, and even minerals like zinc and selenium, which are important for the health of eggs and sperm. Do consult a doctor and get a proper prescription before you start to pop in a lot of these multivitamin pills. Do you know what is the most important cause of infertility in today's life? It is the stress. Stress can work at the level of brain, causing hormone imbalance. Make sure that you're doing some activity which basically keeps you happy. Try yoga, breathing exercises, pranayama, meditation, spending time with your loved ones, or even pick a hobby. Also these days, we have seen that stress of getting pregnant, the stress of even taking the infertility treatment adds to the problem. So beware of the stress, and it is actually not worth it. So getting pregnant was not supposed to be so difficult in the scheme of life. After all, it is essential for the survival of the species. But today, because of modern complicated lifestyles, such a simple thing has also become so difficult and stressful for some of the couples. Have a fertility plan, consult a good doctor, gather information, start a healthy and active lifestyle, and do not get stressed. So today, like always, if you found this information useful, please do not forget to like, share, and subscribe to our channel. Thank you.